I want to talk about tools of the trade in orthopedic manual therapy. Here we've got some different kinds of fasteners. This is just an example. So one thing I could use is I could use an adjustable crescent wrench. I could use a ratchet on that guy. I could use a torque bit on that guy. This is a square bit. This is a large Phillips head. This is a small Phillips head, that'll work for that guy. And this is a hammer. So the hammer will work on the nail. So let's see what happens with our hammer. Let's try our hammer on the nail. Seems to work, right? So the hammer works on the nail. What does the hammer do to the small Phillips head? I don't think it's gonna go well. No, it kind of pushed it in, but it's not gonna be useful anymore. What about this guy? Pushed it in, but it's not going to make it work. What about this? How's this going to go? What do you think? Think about the theory behind why we would use a hammer on a nut. Well, that didn't work well, did it? And that didn't work well. The hammer is a useful tool for a nail, but it's not useful for the rest of those. What's the point of this? The point of this is, to quote my good friend Dr. Philip Greenman, a famous osteopath from Michigan State, if all you have is a hammer, every fastener that you look at looks like a nail. Hammer is manipulation. All these other things, all these other myriad tools, all these other tools are aspects of mobilization. In the Maitland approach, it's kind of like a multi-tool. The Maitland approach has different grades. There are 5 core grades, 1, 2, 3, and 4, non-thrust mobilization. And then we have grade 5, a thrust manipulation. In reality, there are subtleties between the grades. In fact, there are really like 15 grades of Maitland. So Maitland's like a multi-tool and manipulation's like a hammer. It works on nails really well. On the other stuff, it doesn't work well. Do you want to see me crack this with a hammer? Well, I'm not doing it that way. Let's do it this way. What happens if you change a light bulb with a hammer? Well, that's probably what happens, right? That's what happens to the light bulb when you hit it with a hammer. Moral of the story is, assess your patients, treat accordingly. Manipulation is just a hammer, it's just one skill. You need lots of tools in your toolbox, and if you're a Maitland therapist, you have a multi-tool which has lots of tools attached to it. Hope this is helpful.